Hi everybody, Dr. Daniel, and today I'm talking about what has COVID-19 done to the frequency of migraine. I think this is a good question because migraine, for the things that set it off, the number one issue or trigger or aggravating feature that sets off a migraine is stress. It's the number one issue always listed. And 50% of persons with migraine will have depression, and 40% will have generalized anxiety disorder. But still, stress could affect persons with non-psychiatric diagnosis, yet stress and worry are really a big part of the migraine population by the nature of just the being and the inherited gene they have in their brain. So the COVID pandemic has caused job losses, fear, insecurity, parents wondering where their kids are going to school or if they're going to be home or how they're going to be able to take care of them. And it's caused all these things. There's been a huge increase in the economic burden. So one study was done in Australia. They used to analyze the results from a cell phone app called Migraine Buddy. And I have that app listed on my webpage when I wrote an article about migraine apps. That's at drmigraine.com. But anyway, the Migraine Buddy study showed in 2018 there was 4.9 headache days per month in this group they were following. In 2019, there was 5.1 incidents days a month. And then in 2020, there were 5.2 headache days per month. So you've got the list and numbers of headaches have increased just studying this group of patients who were following a cell phone app. This cell phone also reported the triggers that they were following, and they were looking at stress, lack of sleep, neck pain, and anxiety. Well, headache is the number one symptom of all persons throughout the world, and the number one side effect of any medication is headache. So headache's sort of difficult to study in that regard. 99% of headaches, according to the International Classification of Headache System, are either tension type headache or migraine. And the features there are something like 70% of headaches in general are tension type headache and 30% are migraine. And those are called primary headaches in that these persons are sort of born with them, genetic and inherited. But COVID can produce stroke, cerebral hemorrhage. It can produce meningitis and encephalitis, and all of those neurologic conditions are associated with headache. Cerebral hemorrhage, this headache is the heralding event that causes patients to come in. Stroke is about a 10% incidence of headache. Meningitis means inflammation of the covering of the brain. The meninges are the covering of the brain. Itis means inflammation, so there's inflammation of the covering of the brain. And then encephalon is the brain tissue itself, the lobes of the brain. And encephalitis can also cause headache. Now, the headache they're reporting with COVID-19 pandemic is a generalized, moderately severe headache associated with light confusion, sometimes coma, nausea, and vomiting. I personally think it'd be difficult for a physician to differentiate between the effect of COVID causing a headache in a migrainer. In other words, someone who's born with migraine and they got migraine occurring frequently, and now they get sick with the pandemic. I think it'd be hard to differentiate those headaches. But perhaps you could do it. If it was one-sided, if they had migraine with aura, they had an aura event with seeing their aura image, zigzag lines, numbness and tingling, trouble talking, things like that would be easy. But if it's just a generalized headache, it'd be hard to sort that out. Well, what's been the effect of COVID on headache practices? I've discovered one sort of an interview talk from Dr. Merle Diamond, and she's the director of the Diamond Headache Clinic in Chicago. And she stated, I'm just going to read her comments. We're working from home, and oftentimes it makes it harder to have an on switch and an off switch. That's a good point. The change in work can be triggering because migraineurs have very sensitive nervous systems that don't like change. Nor are we getting up and moving, stretching, hydrating, or sleeping as we should, which all can be significant triggers, Dr. Diamond stated. Lack of activity makes migraine worse. Change of schedule makes migraine worse. Sleep is impacted, which always makes migraine worse. and you get dehydrated, and that doesn't certainly help, Dr. Diamond said. So it sounds like she's relating this been an effect on her headache clinic. All right, so next I'm going to go through and list the common features of COVID-19. According to the Information Centers and Centers of Disease Control and Prevention, CDC, the common distinguishable symptoms for COVID-19 can appear 2 to 14 days after exposure to the SARS-CoV-2 virus. And the original symptoms include fever, a dry cough, and shortness of breath. But many others experience other things like fatigue, along with symptoms similar to those of respiratory conditions such as sore throat, sputum production, runny nose, stuffy nose, aches and chills, nausea, vomiting, diarrhea, and headache. So the bottom line here is that any great illness impacting world life situation as strongly as COVID would do is certainly going to increase headache in patients with migraine, which is a condition that relates to stress. So I pray to God that this pandemic will be over. God bless all you folks who had COVID and as well migraine. Please click subscribe down there. Thanks for listening to me, and I'll see you again on another talk.